This video focuses on airway and ventilatory management, which is a critical topic in trauma care. This image illustrates an example of a surgical airway device used for ventilatory support. The content in this video is based on the Advanced Trauma Life Support, or ATLS, 10th edition guidelines. The earliest priority in managing injured patients is ensuring an intact airway and recognizing compromise. Inadequate oxygen delivery to the brain and vital structures is the quickest killer in trauma, making securing the airway and supporting ventilation the highest priority. Our objectives include identifying situations where airway compromise is likely, recognizing signs of obstruction, describing techniques for a patent airway, defining a definitive airway, and outlining steps for maintaining oxygenation. Early preventable deaths often result from failure to recognize the need for airway intervention. Patients with altered consciousness, such as a GCS of 8 or less, maxillofacial trauma, or neck trauma, are at high risk for airway compromise. Objective signs of obstruction include agitation, cyanosis, and the use of accessory muscles. Noisy breathing, such as snoring or stridor, is obstructed breathing. Always anticipate vomiting in trauma patients and be prepared to suction. A patent airway requires adequate ventilation. Ventilation can be compromised by chest trauma, intracranial injury, or cervical spinal cord injury. Look for symmetrical chest rise, listen for air movement, and use pulse oximetry and capnography for monitoring. Airway maintenance techniques used while restricting cervical spinal motion include the chin lift. This involves lifting the mandible upward to bring the chin anterior without hyperextending the neck. The jaw thrust maneuver involves grasping the angles of the mandibles to displace them forward. This technique can be effectively used with a bag mask. A nasopharyngeal airway is inserted into one nostril. It should be avoided if a cribriform plate fracture is suspected. An oropharyngeal airway is inserted behind the tongue. It is tolerated by unconscious patients, but can induce vomiting in conscious patients. Extraglottic and supraglottic devices, such as the LMA or King LT, are placed above the vocal cords without direct visualization. They serve as a bridge to a definitive airway when intubation is difficult. These devices do not protect from aspiration and must be replaced as soon as possible. These images show examples of extraglottic and supraglottic devices, including the laryngeal mask airway and laryngeal tube airway. A definitive airway is a tube in the trachea with the cuff inflated, connected to oxygen, and secured. Indications are remembered using the ABCD criteria: airway, breathing, circulation, and disability. The lemon mnemonic helps predict the difficult airway. Look externally, evaluate the 3-3-2 rule, assess the Malampati score, check for obstruction, and assess neck mobility. This flowchart provides an algorithm for airway decision-making, guiding clinicians through preparation, pre-oxygenation, assessment, and intervention based on the ability to oxygenate and ease of intubation. Orotracheal intubation is the preferred route, ideally using a 3-person technique to restrict cervical motion. The gum elastic bougie is helpful when vocal cords cannot be visualized. Placement must be confirmed clinically and using capnography. These illustrations demonstrate techniques for orotracheal intubation, showing the positioning of the laryngoscope blade and required traction. The image on the left shows the gum elastic bougie. The images on the right illustrate its insertion to aid in difficult intubations. A surgical airway is indicated when endotracheal intubation is impossible or unsuccessful. Cricothyroidotomy is generally preferred over emergency tracheostomy. Needle cricothyroidotomy provides temporary oxygenation through jet ventilation, but is not a definitive airway. It is used when other methods fail. Surgical cricothyroidotomy establishes a definitive airway when an oral or nasal route cannot be secured.